Hey, Mr. Vest. So, as you already know, I'm calling you to talk about the reasons why you decided to get the COVID vaccine because I'm hoping that this conversation will inspire other people and encourage other people in order to take the vaccine as well.
Okay. Help things. Trying to adjust my lighting a little bit because the side of that, I have a new office arrangement, so I'm still trying to get things adjusted. Anyway, um, I don't have family in this immediate area, and I don't have a lot of contact with a lot of other people, but my wife does, and she has two grown sons, and their families live in this local area. She has two grandchildren in the single digit age range, like 3, 4, and 7, I think, something like that. And just the COVID situation in general across the country, um, it all came down to, yeah, there's a risk of potential side effects, but we both decided that we would much rather take the slight risk of potential negative side effects down the road versus the much greater risk of coming up with COVID and then us having health problems, either one of us, giving it to the other one, giving it to other family members. And then we were able to get on the list to get the shots. She ran about 2 weeks ahead of me. I just had my second shot today, and it's only been a few hours, but I'm not anticipating negative side effects from that. And she didn't have any from hers. And this will help us both feel better about potentially, hopefully, not coming up with COVID. And we also felt like it was kind of our responsibility. It's being a responsible individual to try and protect ourselves and each other and other people. So yes, getting the vaccine makes sense.
So, you're saying that getting the COVID shot will keep you or just reduce the amount of risk for not only yourself, but the people around you.
I think all the evidence that I've seen so far very strongly supports that idea that it drastically reduces the risk. Um, the Moderna shots that my wife and I each had are effective against, they were designed for one strain, but they've been shown to be effective for other strains. And with the other and more contagious strains now becoming more predominant, those strains are becoming more of a risk for younger people. And so that brings into account all of my wife's grandkids into that below 20 age range. And it just seems the smarter thing to do. I mean, I am about to be 63 in August. And so I'm in a range where, at an age where I am among the risk categories, higher risk categories. She is a few years younger than me, but close to that. And we don't want her grandkids at risk. And even if you don't catch it, you can potentially transmit it. So again, having the vaccination should help reduce that risk also. And I do come back to it is a social obligation. I was in a discussion earlier on Facebook and came up with the idea that nobody walks up and gets a piece of coffee or gets a big cup of hot coffee and then goes walking around with it going, I'm tough and I don't care about anybody else. So I don't care if I spill this on me or anybody else because it's not going to hurt me and I don't care about anybody. They're going to go, I'm going to put a lid on this and they're going to try to avoid spilling it. Well, I don't plan to catch the COVID. I think I'm in pretty good health, but if I can reduce that risk significantly, and I believe that the vaccinations do, then yes, I think that's a worthwhile thing.
So do you think that people refusing to take the vaccination or the COVID shots are increasing the risk and prolonging this pandemic?
Absolutely. I think those that are refusing it, I have yet to see anything that I consider to be a particularly valid reason for refusing it. Some are saying, well, there's just not been enough science. Well, there has been enough science. And most of those that I have seen expressing reservations based on science, bluntly stated, wouldn't know good science from bad science. They're mouthing words that they've heard from others. And those that are saying, no, that you can't make me do it because it's taking away my freedoms, I think back to polio and any number of other things that we've had vaccinations for years. And I'm old enough to have the scar on my shoulder from the earlier vaccinations. Now, granted, I was young when those happened and wasn't given a choice on it, but my parents thought it through, and I would be encouraging my children to get it. I have talked about it with my college students, and we're all pretty much in agreement that it's a better idea. And one of the other things that came up recently in an article that a friend of mine had posted, and then I got into a discussion about also on Facebook, was that those who don't get the vaccinations are going to impact the health insurance premiums and cost of medical care for everybody in this country, the way things are set up right now. If we have a significant portion of the population refusing to get vaccinated, and then they come down with COVID and survive it, they are likely to have continuing impact on themselves and on the health system because of what COVID does to the body in so many cases. They could come up with a bad cold that could develop into pneumonia or something down the road, and somebody's going to be paying for that. I would rather us be paying for preventive care than paying to try to
Paying for
heal
recovery care.
somebody later. Right. It's easier to, it's less expensive, I think, in the long run to prevent than it is to try to cure.
That makes sense. That's a completely different outlook. But what I heard from one of my colleagues is that in the COVID shots are antibiomes or biomes that are in birth control or that can basically, I was told that for women taking the COVID shot, it will reduce the chances of them staying fertile or reduce their chances of being able to have a baby or have an impact on their reproductive organs. Is that
Mhm.
true?
I don't know. Obviously, I wasn't involved in any of that research. I have heard such claims, but so far I have not read anything or heard anything that convinced me that it was necessarily true, and have definitely not found anything, have not come across anything that indicated it's a significant probability. And if you have a 1 in 10,000 chance of that kind of problem versus 1 in 1,000 chance, 10 times larger, for example, of coming down with COVID and all of its health problems, I mean, each person is going to have to weigh their own risks. And I'm somebody that my wife and I have never had reactions to previous vaccinations. So that helped. If someone had previous reactions to vaccinations, I can see them being more hesitant about it. But I've not yet found anything, whether about the fertility issues or anything else, that seems to be a solid argument against the vaccinations.
Well, just give our audience a little bit more insight on how we know each other. Mr. Vest over here, Mr. Glen Vest over here is a math teacher, college professor. I met him 5 years ago during my freshman year of my freshman year of high school back in August of 2016, and he's been a leader figure in my life since, throughout all my years of high school and even to this day. So, I chose Mr. Vest over here to interview. First person on my list was him because I saw he had a post on Facebook about taking the COVID vaccine, how he was getting, vaccinated, and he was willing to talk about the risk of not taking the COVID shot. And I fully respect his opinion. And I believe I'm not going to speak for Mr. Vest over here on how he feels about me, but he is one of the most logical, honest, and down to earth people I've ever met.
Well, I'm taking that pause in LaCole's statements to say, okay, it's my turn. Um, I have regarded LaCole Purley as one of the more intelligent people that I've had as a student. And I think she is a dynamic individual with a lot of leadership potential. And I think it is very much like her to try to be active in something that she feels is of significance to other people. And I think something like this might, if these videos or these audios uh, even help one or two people change their minds and decide go ahead and go with the vaccine, then I think it's worthwhile. I think a lot of people are refusing on grounds that they really didn't think through. It's kind of like my wife was telling me about falling behind a pickup truck full of gravel in the back this morning on the highway. And whoever had loaded it in there had put too much in there just to suit themselves, did not have it covered, and was traveling fast. And so there was gravel flying out, putting vehicles at risk. And that was someone who was putting their choices ahead of everybody else, which that's a freedom, that's privilege, but it's putting other people at risk, as well as potentially putting themselves at risk because that flying gravel could cause an accident. I still wear my mask when I go out in public. So does my wife, even though restrictions have been reduced or in some cases actually dropped. And we both feel like that social distancing and masking, they're still important. And that the vaccinations are important because it helps our potential to stay healthy, and it helps reduce the potential for us to maybe pick it up and maybe not get it, but share it with somebody else. It's my understanding that the vaccinations even help reduce our potential for sharing, for spreading the virus. And I think that is worthwhile in and of itself, too. So I'm hoping that anybody that hears this or anyone else's message like this makes that decision. Get the vaccination. They're opening it up soon to anybody in the country. So get it. I think it's a good idea.
And I fully agree. I fully agree, Mr. Vest, because just picking back on your previous statement about how taking the COVID shot, re- there's a lot less risk involved and it then cost wise, financial wise, there's a lot less money involved to help prevent a disease or help prevent a health issue from occurring than to cure a health issue that's already occurred.
Yes.
So everyone who's
And
listening right now, it doesn't matter how old you are. I strongly advise, both of us strongly advise that you take the COVID vaccine just to reduce the risk for your own sake and for the people around you.
and it will be less expensive in the long run because people that have had COVID end up with continuing problems. And if you can avoid having it to begin with, you immediately reduce your chances of those continuing problems and the expenses and being a burden on your family. Stay
And on
healthy.
that note, yep, and on that note, guys, there we go.
Okay.